Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody, and thanks for tuning in for Direct Connection. We begin tonight with a condition affecting 50 million Americans that some people see as an inevitable part of aging, but doctors say otherwise. Joining us for our Your Health segment tonight is Dr. Elizabeth Streeten, Associate Professor of Medicine and Pediatrics at the University of Maryland School of Medicine and endocrinologist and clinical geneticist at the University of Maryland Medical Center. Doctor, thank you for being with us.
Thank you for inviting me.
They call osteoporosis a silent disease because its progression most of the time happens with nobody knowing about it.
Yes, that's right. The typical older person you see, or maybe in your family, who has loss of height and kind of maybe curved over, typically doesn't have any pain.
Is the loss of height more about the strength of the bones, which is osteoporosis, or about discs compressing with time?
So you can lose height from both cases, but in osteoporosis, the vertebrae, instead of being beautiful squares, this is the front of the body and this is the back, become a little bit more triangular. And then when you add up the triangles, you get a curve.
At what age does this typically show up?
So osteoporosis typically starts at about 50, and gradually.
The process or being able to actually diagnose somebody with it?
The process is really longer than that. So you can have a low peak bone mass at your best bone health in the 20s. You may just have a genetically low peak bone mass, and that can lead to osteoporosis later on, or you can just have a normal peak bone mass but lose excessively with age.
Is this one of those things where if we lived long enough, we would all develop osteoporosis? Actually
not. Of those who live to 80, about a third of women break their hip, and about 25% of men. So it's really not inevitable. It's really a complex interplay between genetics and environmental factors.
Well, let's start there. How do we avoid it as we age?
Well, good kind of healthy living, avoiding smoking and excess alcohol, engaging in regular weight-bearing exercise. So any exercise where one is on one's feet or bearing one's weight as opposed to in the water, swimming.
So when you say weight-bearing, I'm picturing Arnold Schwarzenegger, and it's not that.
Yeah, well, I would call that weight training. And
okay.
Weight training is actually really good for the bones. Where you're really trying to build up muscle mass, and it helps to counteract the muscle loss that we all get starting about age 50. But the kind of exercise I'm talking about would be the same amount of exercise that would be helpful to reduce cardiovascular diseases like heart attack.
Let's talk terminology for a second. What does osteoporosis mean to a doctor?
So osteoporosis means that the bones are less strong than normal, and that really has two components. The bones are less dense, and then the quality of the bone tissue is reduced, so that somebody with osteoporosis is more likely to break a bone with a mild fall.
There's also an intermediate diagnosis or term.
Yes, so low bone mass, or is also called osteopenia, is the same process. It's really a continuum, but less severe.
Let's take some phone calls. If you have a question about osteoporosis, give us a call. We'll have the number up on the screen. You can also tweet your questions. Twitter address is @MPT News. We'll begin in Arundel County. This is David. David, thanks for the call. Go ahead.
Hello, Jeff.
Hello.
I'm caller, and I think I have some good advice for people that suffer from this condition. If you go with physical therapy and you go with a proper acupuncturist, a lot of this will be relieved. My wife has experienced it. Myself, I had a knee. My wife's a little overweight. I'm not overweight, but if you practice these two things, you can minimize the osteoporosis that sets in with age.
Thanks for the call. We'll get the doctor's view of that. Good advice.
Well, I'm wondering if the caller possibly might be confusing osteoarthritis with osteoporosis. I don't know if that's the case or not, but physical therapy and acupuncture can help the pain related to chronic fractures and osteoporosis, but it won't really help the process itself, the disease itself.
Let's take a call from Baltimore City. This is Marsha. Marsha, thank you for the call. Go ahead.
Hi, I was diagnosed with colorectal cancer 5 years ago, treated. During that time, I noticed that I became bow-legged. And, of course, I had a lot of complications with my treatment. I had 2 ostomies. I'm, clear now, but I did have osteoarthritis in my knees, but my doctor just recently found that my vitamin D level was down, and she put me on a once-a-week dose for 3 months. And I don't eat dairy products, and I was taking multiple vitamins with calcium and vitamin D, but still I had this problem. So what else can I do to, help myself and other people who may be looking at this kind of a problem?
Marsha, best of luck. Thank you for the phone call. A lot of stuff to tackle there.
I hope you're doing better now. With removal of part of the colon, this is an important risk factor for vitamin D deficiency because vitamin D is absorbed in both the small intestine and the colon. So this may be why the caller became vitamin D deficient, is there was less surface area of the bowel to absorb vitamin D. There really isn't enough vitamin D in foodstuffs, so we primarily get vitamin D from the sun. And of course, we're all out in the sun less than we were because we're inside.
Especially today.
Especially today. We're inside on our computers and we're wearing sunscreen when we are out. So vitamin D deficiency is more of a problem. So to retain the vitamin D replete state, most people really need to take a vitamin D supplement.
Okay, so we had talked about a healthy lifestyle, getting some exercise and a balanced diet, but even if you're doing that, this is for somebody without a diagnosis of osteoporosis. Still look after your vitamin D?
Yes, that's correct. Vitamin D is very important for bone health, and the further away from the equator one lives, the shorter the period of time is that you can make vitamin D in your skin.
Let's talk to Chris in Montgomery County. Chris, thank you for the call. Go ahead.
Thank you very much for taking my call. Following up on the idea of the vitamin D deficiency, I was calling regarding that in terms of absorbing calcium as you get older, as well as are there different risk factors for men and women?
Okay, thanks for, very interesting, in terms of men and women in this condition.
Yeah, so I think men are kind of forgotten in osteoporosis the way women used to be with cardiovascular disease. Men do get osteoporosis. It's important for them to know this. The amount of vitamin D that men and women need is similar, but it's partly related to size. So people who are larger need a higher dose. And the best way to determine whether you're getting enough vitamin D is a blood level, vitamin D blood test.
What percentage of your patients with osteoporosis are female? I've read it's a significant majority.
It's about half. Osteoporosis is half as common in men. So in our lifetime, one out of every 2 women will have an osteoporotic fracture, whereas for men it's 1 in 4.
And in men, even if somebody has a diminished bone density, bones tend to be bigger to begin with. Are they less likely to fracture?
So yes, but men are starting out with more bone, and that is one of the reasons why they're less likely to fracture.
Let's get some more calls, but I wanted to ask you about the testing.
Yes.
How would you determine, can a plain X-ray do it?
So there are 2 ways to diagnose osteoporosis, and one is by the occurrence of a hip or spine fracture without any other testing. That's osteoporosis until proven otherwise, so it could be cancer or some other problem, but hip or spine fracture alone is enough to diagnose osteoporosis, or a DEXA, bone density, which is very simple 10-minute X-ray type test.
Arundel County, this is Mark. Mark, thank you for the call. Go ahead.
Hi, thank you.
You bet.
I'm curious about this condition because I've had some problems recently with my spine. But I get that stressing bones and muscles is a positive thing to do. And I wondered if you really had to pay attention to all the bones in the body, essentially, or if there's specific things that would be most beneficial to exercise.
That's a great question. Thank you.
Yeah, that's a great question. So the only the bones that are loaded or exercised will improve from that exercise. So for the hip bone, walking, treadmill, actually adding a little impact, such as jumping jacks or any kind of jumping is good, but that's not going to help the arms. So for the arms, you would need to do weight training to really build up the muscles and build up the bones. So only the bones that are loaded will improve from exercise.
What do you have in the way of medical treatment for this? You can say diet, exercise, but you have some medications as well.
Yeah, so for most patients who have true osteoporosis, calcium, vitamin D, and exercise really are not enough. And we have a number of medications. One big class are the bisphosphonates, and then we have others that are used in different situations. One is called Prolia, another one is teriparatide. And these medications reduce the risk of fracture by 50%. So they're very effective, and I think there are some rare but potentially serious side effects, which has caused a problem with, I think, getting the right people who need treatment to actually accept treatment and get treatment. So in my clinic, I spend a good portion of many visits just reassuring patients that the medication I'm recommending is really not as potentially dangerous as they're thinking.
Maybe this is obvious, but why does this fall under endocrinology?
So historically, the first drug available for osteoporosis for women was estrogen. And endocrinologists know a lot about hormones, and so it came into the endocrine realm. In addition, vitamin D and parathyroid hormone are very important for the bones, and those are all within endocrinology. But there are other specialists, such as rheumatologists, who treat osteoporosis. It sort of depends on the region you live in.
Let's go out to Allegheny County. This is Lisa. Lisa, thank you for the call. Go ahead.
Hi, thank you for taking my call.
You bet.
I'm in my late 50s, and I'm wondering, when should I get a bone density test, and should it be on my knees, my hips, my back, my shoulder?
Lisa, thank you very much. How do they do that?
Yeah, good question. So the DEXA is done of the spine and the hip. That's the standard. And all women over 65 and men over 70 should get a DEXA. And younger women who are postmenopausal who have other risk factors. So those would include low body weight, would include certain medications like chronic prednisone use. Those who are Caucasian are more at risk than those who are African American or Hispanic. Those who smoke or who drink excessively or have an early loss of estrogen. So those would be all characteristics that would come into play in whether the caller should have a DEXA.
Does it run in families? Is there a family history of this?
Yes, osteoporosis is very hereditary. If you yourself have a normal DEXA, but your mother or father broke a hip, then your own risk goes up quite dramatically. And so it is, genetics are a very important part of it.
Sussex County, Delaware. This is Gay. Thank you for calling. Go ahead.
Thank you for taking my call.
Yes.
Doctor, I am a Caucasian woman, 79 years old. I have had one hip replacement, and I am, I think, due for another one. I have another appointment with my doctor soon, who did the first surgery. I'd like to know, does this relate to osteoporosis, this having to have knee surgery and having to have hip surgery? Is this a part of osteoporosis? Will it lead to that or not necessarily? Thank you.
Thank you.
So again, a very good question, an important distinction between osteoarthritis, which is probably what the caller has. Osteoarthritis is a disorder of the cartilage and the cartilage is at the end of the long bones and makes up the joints. And that's really a totally different situation from osteoporosis, which is a problem only of the bones themselves.
Interesting that we've had that confusion with two callers.
Yes, it's a common confusion among people.
We talked about vitamin D a bit. Calcium, do calcium supplements make sense, or having dairy in your diet, or what about people who can't tolerate that?
Yeah, so calcium is an important component of bone, and those who don't get enough calcium are more at risk for osteoporosis. I generally try to get patients, try to recommend it in the diet. Dairy products are the richest source of calcium, but for those who are lactose intolerant, there are many alternatives now. There's many milks that are not cow-based, almond milk, soy milk, and for those who really can't get it in the diet, then a supplement is recommended.
Let's take another call. Howard County, this is Pam. Pam, thank you for the call. Go ahead.
Hi, thank you. I'd like to know, are you able to stop osteoporosis? And if you can stop it, are you able to reverse the damage that's been done?
Very good. Thank you. Do the medications do that?
Yeah, so the medications...
and also without the medications, but start there.
Yeah, so with medications, yes, we can absolutely halt the process and reduce the risk of fracture. Now, in terms of increasing the amount of bone that's there, we have only one drug that can really do that. That's the so-called anabolic agent. The other drugs work primarily by reducing bone breakdown, but the end result is the same, which is a reduction in risk of fracture. And so, yes, absolutely, we can do something about it and reverse the effects of it.
Very good. Dr. Elizabeth Streeten of the University of Maryland, thank you for your time.
Thank you.
Appreciate it. Just ahead tonight, a perspective on the Martin Luther King Jr. holiday from the outgoing head of the Reginald F. Lewis Museum.
Tonight on MPT.
Next time on Antiques Roadshow, this is Ben. This is Ben's guitar. Once there was a time when Ben's guitar was hot in more ways than one.
He said that guitar has been stolen. And of course I was sick. I couldn't believe it. I figured somebody'd hawk it if they stole it.
Find out how Ben got his groove back next time on Antiques Roadshow from Spokane, Washington.
Tonight at 8 on MPT. He's a caring man of the cloth.
Guilty as charged.
With a special gift for solving murder cases.
I don't so much look for mysteries as they come looking for me.
Whether his help is asked for...
Mr. Quinton could not have hanged himself.
Or not.
What is it with that priest?
The clever crime solver.
So what do you think?
I think you're being too suspicious. With divine inspiration.
I only want to uncover the truth.
Father Brown. Tonight at 10 on MPT.
It's this whole Romeo and Juliet romance.
The real story of a Texas twosome forever linked in life and death.
There wasn't going to be any arrest or any trial.
Bonnie and Clyde on American Experience.
Tuesday night at 9 on MPT.
Joining us now is Skip Sanders, Executive Director of the Reginald F. Lewis Museum. Sir, thank you for being with us.
My pleasure, Jeff.
You're retiring at the end of the month?
Yes.
Third retirement, I hear.
Everyone laughs at that. It really is my third retirement. I don't believe in doing nothing, and I've just been blessed to have other things to do when I've retired that take me on to the next step.
Collector of gold watches, perhaps. So
no, but that sounds interesting.
So you were an educator first, and you've been running the museum for the past 3 years?
For close to 4.5 years now.
Okay.
So I had been previously at the State Department of Education serving as a deputy for Dr. Nancy Grasmick, who was a great, great superintendent, as you know. So,
right.
And that was the experience of a lifetime.
Let me ask you your perspective on the Martin Luther King Jr. holiday from the perspective of somebody running one of the more important African-American museums in the country.
Well, actually, I have to tell you, it's very uplifting to see how much that holiday means to many people and many kinds of people. For instance, we had a celebration over the whole weekend this year, and I was just tallying, I think well over 1,000 people have come through the museum. 515 today, 400 and some on Saturday, and that's not counting a very special event we had today that was sponsored by BGE and the Ford Fund called Men of Courage. Very, very special kind of meeting just of African American men, talking about the state of African American men. Which is so apropos given everything that's happened in our city recently. But it seems to me that people are finding ways of trying to use the legacy of Dr. King to explore in greater depth things that are still of concern to us today. One of the things I'm glad about, and I'm not trying to disparage the dream, but for so many years we heard about the dream. He was not a dreamer in that sense. He was a very, very practical man, and he was speaking to things that had to happen realistically in our society to get to the dream, let's say. And so for me, it was really gratifying to see children coming in to learn, adults coming in to look at the documentary films that we had and explore in greater depth what he really did in his life, and then other people really trying to apply what happened as he was living and what he was addressing to circumstances today. He certainly addressed economic disparity as one of the things that holds back the great kind of American dream that we have for this country. And so thinking about that today, if you want to look generationally at it, think of what the younger generation is facing compared to what my generation faced in terms of opportunity and how you get it, and maybe how quickly you begin to get the rewards of all your education and your labor. It's harder for young people, whoever they are, to find a job now.
Yeah,
it takes
somehow
longer.
It's no easier, it seems.
No, I think it's harder, really. And so I think when you look across the different segments of our society, you see people applying what he was talking about to their circumstances, which
How
I
much
think is great.
do you think of the museum as a repository of history versus being an active participant in events in the community?
Oh, that's a great question, and it's a great discussion that's going on now. I think a museum is both. I think the classic view of the museum may have been this place that was a repository, and you went there and there was sort of a calm, meditative air, and you looked and you learned, and maybe you learned more history than you had known before about whatever the subject was. But museums have had to compete in a world where there's so much to offer and there's so much going on. So in that sense, I believe all museums have had to think about how they're going to define themselves for the present and the future. When people have dollars to spend on something and on their leisure, what are they going to spend it on? And if you want them to come and spend it on learning experiences like you're having, I think you have to really go that route. You've got to create experiences. It's got to be engaging. It can't be simply passive in the sense of you looking at something, reading an interpretive panel, and moving on.
And it has to evolve in some way. The Lewis Museum is about a decade old now, I guess. And most of our viewers, I'm sure, have been there. The trick is to get them to come back.
How do you come back? And I think you get them to come back by producing educational programming that extends or talks more about the artifacts you've seen. In many cases, and we're lucky in this respect, we have our collections at the top floor of the museum. Many museums don't have the room to house their full collections in the building. And as people say, some of the best stuff you never see because it's out of sight.
What's the best stuff today? What's the most popular exhibit that's bringing people in?
Well, in recent times, I would say I would go back to the Kinsey collection, which had so many original documents. I mean, a copy of the Emancipation Proclamation that went out to the military this September before the January proclamation, a copy of the Dred Scott decision, and for me, there was the actual signature page of the Brown versus Board of Education decision with the justices' signatures. And when you put those documents together and you really saw the flow of history, where it wasn't until Brown versus the Board of Ed that African Americans were really given sympathetic treatment as persons and equals. That was a tear-bringing moment for me.
Skip Sanders, director of the Reginald Lewis Museum. Mr. Sanders, thank you for your time tonight.
Well, thank you so much for having me.
We appreciate it. Thursday at this time on Your Money and Business, expanding healthcare services in Western Maryland. And join us Friday for State Circle and the latest on Maryland politics. Now, for all of us at MPT, thanks for watching and have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.